The cervix doesn't have nerve endings, is what I was taught in my OBGYN residency. I have since learned that that is not true. When it comes to an IUD insertion, some patients will feel nothing, and some patients will feel everything. And I don't know if you are the nothing or the everything patient, which is why I treat my patients as if everyone is the person who's going to feel everything. For this reason, I talk about pain management options with all of my patients in 3 phases: the pre-insertion phase, the insertion phase, and the post-insertion phase. My preference is to have this conversation with my patients prior to their IUD insertion appointment because I want to know, have you had an IUD before? How was that experience? What can we do differently this time? Or is this the first time that you've had this? What have you heard? And how can we make sure that we're managing your pain? When it comes to the pre-insertion phase, there are several different medications and options we can use to help manage pain and the anxiety associated with having a procedure done. For all of my patients in the pre-insertion phase, I do recommend an NSAID. And before you say, of course, the OBGYN is only going to give me ibuprofen, that's not true. But NSAIDs are important when it comes to managing the cramping associated with an IUD. And for that reason, I do recommend 600 to 800 milligrams of ibuprofen 2 hours before your IUD insertion appointment. I think it's vital to also address the mental anxiety associated with having any procedure done. This isn't to treat the pain of an IUD insertion. This is to really recognize that people have anxiety about any type of procedure, whether it be an IUD insertion or an MRI. And for that reason, if my patients do feel anxious about having an IUD inserted, I'll talk to them about taking a one-time Ativan about 20 to 30 minutes prior to their insertion appointment. During the insertion phase, every doctor's office is going to be different in what they can offer you. Most places are going to have lidocaine available, and some places are going to have other options like nitrous oxide, and some places even can do like a conscious sedation. I'm more limited in my office currently, so what I offer my patients and what helps a lot is a paracervical block. A paracervical block is a lidocaine injection that goes either into the cervix or around the cervix. Keep in mind this is an injection, so there is pain associated with that injection. But I find this incredibly helpful in 2 steps of the IUD insertion. If I'm using a tenaculum, I like the lidocaine right into the cervix because it's going to numb that part of the cervix. And while not everyone will feel the tenaculum, I personally did not during my own IUD insertion. Some people do feel it. So again, I offer it to everybody. The actual paracervical block where I inject it around the cervix is helpful for the pain associated with the actual insertion of the IUD device. For some people, that cervix is going to be a little bit more stenotic, so having it opened up can be painful for some people. This is especially true for those people who haven't recently had a baby or aren't currently on their period. In the post-insertion phase, we again have several options. Again, I'm going to recommend that everyone take NSAIDs because it's our safest option for managing cramping, and it really is one of the best options that we have for cramping. So I tell my patients to set themselves a timer for every 6 hours so they can take their ibuprofen or their Tylenol. I just prefer ibuprofen. I also offer my patients several oxycodone because some people are going to have extreme cramping associated with an IUD insertion. This is another great talking point in the pre-insertion phase so that the patients can have it ordered and ready for them after their insertion so they don't have to stop at the pharmacy. I would say using these measures I have available in the office is enough for about 95% of my patients to have an IUD inserted where they come out of it saying that wasn't as bad as I thought it would be. But there are a small percentage of people who will not tolerate an IUD insertion even with these methods. And for those people, we go to the operating room. Now you're probably asking yourself, well, why doesn't everyone go to the operating room? A lot of people tolerate an IUD insertion without any pain medications. I was one of those patients. I had an IUD inserted and I felt nothing. For me, going to the operating room would have been overkill. The other problem is that insurance, for the most part, does not cover the trip to the operating room. So for some patients, that $3,000 bill to go to the OR is something that they can't financially handle. Trust me when I say that I know that my field has not done a good job of always acknowledging the pain associated with an IUD insertion. And I think there are several valid reasons for why the field thought that, and then there's many invalid reasons. And so as we continue to have data that supports the use of things like a paracervical block, more and more doctors are going to feel that it is necessary. And so I hope that understanding the options a little bit more will help you have the chance to advocate for yourself better. If you haven't found a doctor though, or another healthcare provider who's willing to help you work through these options, I do have a list in my bio of healthcare workers across the country who will.